Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you chose to spend this time with us, and we are excited to share our presentation with you today from one of our regular visitors, and this is a repeat presentation. We're very happy to say she has chosen to share her genius with us again. And without further ado, I will turn it over to our founder, Dr. Randall Maxey.
Good afternoon, everyone. Hope you're having a great Sunday afternoon. Thank you, Dr. Neighbor-Stevens, Dr. Walks, and Dr. Hines. We do have an outstanding guest, one of my heroes, I should say maybe sheroes, that I've admired for a long time. She got stolen by Tennessee away from Los Angeles, but we'll forgive that. I received a note from one of our advisory board members this morning that the Department of Public Health in Los Angeles is stating that adults 65 years and older are now recommended to receive an additional dose of the updated 2023-2024 COVID-19 vaccine. This provides additional protection in older adults that are at increased risk of severe disease. And they suggest that you call your health department for further information, but I'd like to make that announcement. Our guest today is the famous Dr. Xylana Bean. She is chair of the Department of Pediatrics at Meharry Medical College, where I think Dr. Neighbor-Stevens was in that department a short while ago. Is that right, Dr. Stevens?
I was there for a number of years.
And what else can we say about Dr. Bean?
Dr. Bean is a very rare person. You know, there are not that many Black pediatricians in this country. And I don't think a lot of people understand that or know that. So I always like to put that out there. When you meet a Black pediatrician, you're meeting a rare gem. And Dr. Bean has had the opportunity to first be trained and then to serve in our community, and has a wealth of knowledge as well as experience. And I saw her title and I said, I can't think of a better person to address this, because she's seen it. She's seen it all.
And the title of our talk today is Public Health versus Public Policy. Dr. Bean, welcome to the stage.
Thank you all. Oh, I'm going to try sharing my screen. I said I was going to try to do this myself. I will admit to being technologically incompetent. And I am so, well, I keep taking great pride in it, but I realize that it really isn't a reflection of something to be prideful for. It's just a reflection of laziness. But at this stage in my life, I like to reserve my memory and my training and my skills for things I have to actually use. I got an assistant for this, and that's one of the criteria for when they get hired, that they're able to do this. Now, how do I get rid of the side thing? Or do anybody care?
There is a little picture of a slideshow, and if you click on that, it'll go away.
Yeah, that's not it. I thought I'd gotten it down at the bottom.
Down at the bottom?
Or at the top? Up
So
here.
there's one.
Up here at the top. Anyway, and I went to YouTube, by the way, and looked this up. And when I looked it up, they told me that having it on the side like that was distracting to people who were watching, and that it was much more professional and better if I could get rid of it. But since I have problems getting rid of it, you all may have to have the pleasure of being distracted.
Yeah, poor Simon.
I don't know if poor Simon could do it. He's like my Leland. Leland does everything, and his contention is, Dr. Bean, don't touch. Just push the button. But because I inevitably tend to mess it up. Anyway, this session is specifically I'm doing at the urging, and not urging, but at the suggestion of Dr. Maxey there. Because he said to me, as a pediatrician, he said, do something. I'd like to learn something about what to do with my grandchildren. And it's interesting that what the announcement that he made about the public health department recommending vaccines, a new vaccine, or it's not a new vaccine, updating their recommendation for older adults also ties in very well with, oh, no, I got it, I did it. But anyway, I'm so proud of myself. With what it is we're going to talk about today. Now, we have a lot of public health people here. Am I correct, Dr. Waltz over there?
Yes, ma'am.
And so feel free to come in and address some of these issues. And that's one of the reasons I also chose it, because I wanted the pleasure of having input from some of my colleagues with a whole lot more public health knowledge and expertise than I do. But I decided to choose this topic because, like so many things in this country, which used to be things that we just normally accepted and assumed were part of good health and were accepted as part of this is just public health, like vaccinating your children was not a controversy. But at this point, everything seems to be a controversy when it comes to healthcare. And we are now, in addition to holding women's health, we're looking at holding children's health hostage to political ideas. Now, we all know that, being doctors, that one of the major achievements in the last couple of 100 years was vaccines. And it has contributed so much to decreasing disease, preventable disease, both in children and adults. It is probably one of the things that unequivocally, as physicians, we've always been able to hold up as a major achievement and that everybody agreed to. But as you know, it has become another source of controversy. So we're going to give people an opportunity to address some of those issues as we go along. So as I said, feel free to comment as we go. And I'm going to try to keep this whole discussion is designed to be around the idea of allowing me to bring up some issues and then having you all contribute to the discussion. And by the way, I know Barbara, Dr. Barbara Nabin-Stephens will have some opinions, considering she also has a long background in this, as well as her work with one of our major providers of health insurance, which is part of the issue in terms of addressing vaccines at this particular point. But we all know that Edward Jenner smallpox developed the smallpox vaccine, and it was in 1796 when he wrote the paper. He'd been working on it for several years. Now, this story represents some interesting facts because, as you know, and I'm not going to talk about Tuskegee, by the way, except to mention the fact that, as you know, when he developed the smallpox vaccine, didn't have no IRB. And I doubt very seriously if the 8-year-old that he introduced cowpox to actually had signed an informed consent. But, and we all know that that's one, whenever we're talking about medicine in this country, and that specifically it involves for African Americans, for example, COVID and influenza. They always raise up the issue of trust and bring up discussions around Tuskegee, et cetera. This is not a discussion of that, but if anybody want to raise those issues later on, that would be perfectly fine. But the other reason is that smallpox is the only preventable disease at this point that we have declared eradicated. And in fact, the smallpox vaccine is the only vaccine at this point that we have actually no longer give, because we have decided that it is a disease that has been eradicated. The last document, that was around 1972 or so, the last documented case of smallpox was actually in 1977, and it was reported in Somalia. And if you're in Tennessee, that kind of makes you feel, because we got a whole lot of Somalians in Tennessee, but it's theoretically, the success of the smallpox vaccine makes you think that actually we should, of all of these years, why have we not eradicated more of the preventable disease. We'll spend a little time later on when we talk a little about polio, et cetera. The Advisory Committee on Immunization Practices, which is a subcommittee under CDC or advisory, and is the organization or the group that sits around it and decides for us what vaccines we should have, as Dr. Maxey pointed out. And they then tell public health people what it is that in theory they should be recommending to their patients, and that comes out to the providers. And we'll spend time on vaccine hesitancy and vaccine refusal, because as I said, this is health policy versus health politics, which is what a lot of this is. Now I see there's one thing in the chat, but if somebody wants to look at the chat as we go along so we can answer people's questions, address those issues, because I'm not sure if I'm sophisticated enough to switch from the presentation over to the chat until I finish with the presentation. That may be beyond my abilities, people, but somebody should look at the chat and make sure that if not something we should address immediately or could address immediately. This is your, Dr. Maxey, this is your immunization recommendations for children up to the age of 18 for 2024. And this list comes out every about January of every year. And if you're a pediatrician, you will always look at it and you post it on your wall so that when you come back to make sure that you have checked on the, to make sure that all of your children are up to date and that you have checked the appropriate ones, and to make sure you counsel your patients. And you can see this is part of the controversy when it comes to vaccines for children. There is a ledger at the bottom, which we'll come back to, but the bottom line is the ones in yellow are the ones that are recommended for all children. The other colors represent ones that have notes attached to them, which say there are caveats to them. An example, for example, it would be for a child, you have to take caution with children who are immunosuppressed in giving them live vaccines. And the live vaccines are the MMR and the varicella, for example. You also have to, oral polio is also a live vaccine. Now, one of the things in this country is that we use inactivated polio vaccine, and all of you probably know this story of polio, how we got polio, and part of that, of course, in FDR, et cetera. And we were talking about Nikki Giovanni just before we started the session, and she was giving credits for the March of Dimes to, let me get it correct, the Alphas. Am I correct, Dr. Barbara Neighbors-Stevens?
I am not aware of what the Alphas do, but March of Dimes is a major partner for Delta Sigma Theta.
Oh, Deltas. I am not a sorority person. But I do know there are Alphas and there are Deltas. So it was the Deltas who got reported for it. And the Deltas are generally known to be more activist. I shouldn't say there's probably some Alphas in the room. A sorority, so I should know that already. Anyway, in terms of, and as a child, I ran around with that little bitty thing and asked for dimes and filled it up, which was necessary for doing the polio vaccine when we were trying to do the polio vaccine, which is interesting because as we'll mention later on in terms of some of the controversies, we have yet to eradicate polio. And that's been a WHO goal for the last 50 years or so. They have yet to eradicate polio, and most of that is in the rest of the world. Wild polio has felt to be pretty much eradicated in the US. So many of you will recall having gotten that little, if you were my age or around that age, they had switched. I got the shots, by the way, and also got the little bitty sugar cube with the little pink stuff on it because my mother had polio. And since my mother had polio, she therefore figured we should get everything there was. So she took us, so at school, I don't know if any of you remember when they introduced the inactivated polio vaccine, we all would, one day we came to school, we were lined up and we got a shot. Later on, when they introduced the Sabin or the oral dose, even though we had gotten the shots, My mother took us right back to the health department and we got the oral one as well. Well, in this country, we have switched back from using the inactivate the oral one, which is a live vaccine, to IPV, which is the inactivated vaccine, which is different from what the rest of the world does. Now, that's not surprising because, as you know, the U.S. has a tendency when it comes to healthcare, public health especially, to do things different from everybody else in the world. So that's the inactivated polio. That's one of the major differences when you look at the vaccine schedule here versus if you were traveling other places, which I know many of you do, and doing mission work in that, because it's the WHO which is responsible for vaccinating most of the rest of the world outside of the developed countries. And we'll come back to that. This is your adult schedule. And as was pointed out, in addition to the your annual polio, they're now, of course, recommending you get an annual COVID and an annual polio. And for those of us who resisted forever, this year I managed to got my shingles, my polio, and my COVID. Finally, but now and the good part is you can get them both at the same time. So this is the schedule that they noticed. Note that there are little captions at the bottom saying those which are recommended, of the ones which are in yellow, and then the other ones have notes attached to them in terms of saying which population. And as Dr. Maxey pointed out, one of the populations they're recommending an annual COVID, but now they're recommending even if you got a COVID this year, or you would go and get another COVID with the updated version of the so-called bivalent, if you are at risk. So that's why you get the little purple things that say, with little notes that say, which at the bottom of the page would be a whole list of people who we would recommend, because if you are at risk, you should have. Now, they have this concept. So this concept of recommendation. Now, for pediatric patients, there are mandates. And again, we'll speak a little bit later on about the issue of mandates for vaccines, but there are mandates. They are both a quality measure if you are a pediatrician, a number of they wrote a recommendation, or they assess you on how many of your children are fully immunized and their definition of fully immunized, by 2 years of age. So that generally means that they have had their primary series of DTaP, diphtheria, tetanus, and polio. They've had which is 3 plus 1 booster, and that they have had their 1 MMR, 1 varicella, their hepatitis B, their hepatitis A, note all of these vaccines, by the age of 2. That's a quality measure. By the time you are 4 or 5, when you get to go to school, schools require you to have been fully vaccinated before you start school. That is now a controversy, of course, and a political thing, which we'll spend a little time talking about. Then you're adding in a second dose of MMR and varicella. Just for y'all's information, your old DTaP, your DTP is now DTaP because of the problems associated with vaccination, or the side effects. It turns out that most of the side effects, the fever, sometimes an occasional seizure, et cetera, were associated with the original pertussis vaccine. We now have a new pertussis vaccine called acellular vaccine, which we have been using for some time, long enough to have discovered that it's not as good as the old vaccine. So consequently, they recommend you repeat it at every 5 years. And that also occurs, and we'll talk a little about special population like pregnant women, because those of us who are our age can remember the concept of whooping cough. And most of our younger colleagues have never seen it, should never see it, and don't know anything about it other than what they read in books. But it actually is a real disease, and one that we actually, again, we see a resurgence of, which is the reason they changed the recommendation. For adults, they use this concept they don't have mandates, they use this concept of shared decision-making. And for respiratory syncytial virus is a classic example of shared decision-making. And by the way, I got mine because I'm around so many children still. since I am still working, I figured I was going to get exposed. Probably had it before. Obviously, if you have a respiratory problem, et cetera. So in shared decision-making, the concept is supposed to be you talk to your doctor and you all make a decision as to which vaccines you absolutely should get and which ones that you can make a decision about. I've had every one of these. So that's from my point, and never had any, I've been lucky enough not to have any side effects. However, everything you do in medicine has some potential side effects, which is always the issue. Some of these are interesting. So for example, HPV vaccine was originally marketed and recommended only for girls. And it obviously is, HPV is responsible for both cervical cancer as well as related to other forms of cancer as well. And now it's recommended for males as well as for females, because it's also associated with penile cancer and with oral cancer as well. So that vaccine goes all the way. So it was originally recommended up until age 26, but now is recommended beyond that age for they've extended the recommendation to the 27 to 45 age group. And we've already discussed a little bit about the recommendations we said on COVID. This is not a COVID lecture, but everything's a COVID since COVID occurred. Everything's COVID. Now, meningococcal is an interesting one because it is meningococcal A, which is the most common form of meningococcal, is one of the ones we do routinely. Meningococcal B, however, is not an absolute required vaccine. Again, it's under the shared decision-making, but it's the most common cause of meningitis in your college-age kid, and also in military, where people congregate together in large groups, specifically the military, so which is why it's under the shared decision-making for the older child. Okay, vaccine hesitancy, which is where parents are now questioning the value of vaccines, and also are often requesting what we call an alternative vaccine schedule. Remember that all these vaccines on that first list, most of them had to be administered by age 2. That's when it was designed to do. We now have parents who are saying, I don't want to give my kid all of these vaccines, so we'll spread them out. There is no data that suggests that that's of any benefit. It probably is not of any harm, except when you decide to do things like, I'm not going to give you, which I did, I'm not going to give you this RSV vaccine until you're a month old, even though you can give it at birth, and you get RSV a week later and wound up in the hospital. Those are the kind of issues that are addressed when you decide to spread out the vaccine. So it's not really a recommended way of doing it, but it falls under vaccine hesitancy, which we'll come back to. Now, pandemic of 2019, as you know, one of the things that occurred during that time period was that we shut down, except for essentials. So children being fully immunized was one of the sacrifices that was made. But what is the issue, of course, is whether or not that, and all of the controversy around the COVID vaccine, whether that made a difference in terms of now that we are trying to catch up, whether or not parental attitudes have changed towards vaccines. And we'll talk about that a little bit later. But in this country, all of the data suggests in most recent studies from CDC, and I have one reference, which is the Pew Foundation survey, which shows that vaccine hesitancy has been stable at about 20% before the pandemic and after the pandemic. What has changed is there is a whole lot more misinformation and disinformation that is in the media. And in many ways, if you didn't actually look at the actual data, you would believe that the norm has come, that that families or parents no longer want to give their children vaccines. It is reassuring to know that that is not true. And again, it is a concern. And so I'm not going to say it's a media hype, but it turns out when you actually do the surveys, the data is that it's been about 20% before and about 20% after the pandemic. Why is there vaccine hesitancy? Lots of reasons for vaccine hesitancy. We talked a little bit about the issue of side effects. The side effects are relatively minor. And as you know, we actually have as a provider, you actually are protected from lawsuits because there is a separate vaccine injury fund that's been set up. And when there is a suggestion or some evidence that this outcome might have been, a poor outcome might have been related to the vaccines, it goes through that system. So you as a provider for children do not get, are not subject to lawsuits or subject to legal sanctions for that specific injury. However, there are a lot of other issues, and we'll come back to that. In 1995, these were the recommended vaccines. And as you can see, you had Hep B, you had DTP, as opposed to the DTAP. I talked about it now. We use Hib, which is against meningitis, polio. And again, it was oral polio instead of the IPV. And we had MMR. Remember your vaccine schedule now, which is a whole lot different from what you got when you were a child. So we have gone from 1, 2, 3, 4, 5. By the way, DTAP is 3 together to 14. So there are now 14 vaccines that are recommended. There's also different products, different recommended schedules. So one meningococcal manufacturer gives 3 shots, gives 2 shots 6 months apart. The other one gives 2 shots 1 month apart, for example. And we have providers who just make a decision. Sometimes that decision is patient choice, and sometimes that decision, and we'll spend a little time talking about cost, is cost related as to which products they're going to have and which ones they aren't going to have. The good part is that they are now combining vaccines, and combining vaccines, it turns out, is very safe. Just like you can go and get your COVID, your RSV, and your influenza all together at one time. They unfortunately are 3 shots, but you can get them all at one time, and that appears to be safe and effective. For children, we, however, do have combined vaccines. So, for example, the MMRV, measles, mumps, rubella, and chickenpox is one vaccine if you're 4 years old. On the other hand, if you are 1 year old, when we give it the first time, you have to give to the chickenpox can't be combined. It's not combined. So there is an MMRV vaccine that we use for older children. Note, Pediatrix has your DTAP, your Hep B, and your IPV. On the other hand, Pentacell does DTAP, IPV, and Hib. And the last one, which we just brought on board, the DTAP, IPV, Hib, and Hep B, which is called Vaxelis. All of these, by the way, cost more money. So, and many providers make a decision as to how they're going to give them. But as you can see, this could be a little bit confusing for parents, but we use it primarily to reassure them. And most parents actually appreciate the idea that we say, you're getting 7 vaccines. How many vaccines am I getting today? You're getting 7. However, you're actually only going to get 2 shots, which makes a whole lot of difference. And then you tell them which ones are combined. All right, this is just an example of how the meningococcal vaccine, as I pointed out, where you've got 3 different producers of the vaccine, and they all have their own vaccine recommended schedule. All right, vaccine hesitance. And as we said, it's consistently about 20%. The vaccine rate among kindergartners, as you can see, even though the vaccine rate among kindergartners, which is another criteria that we use for effect, that we have fully immunized, has not changed significantly, but it is trending. And so 2019, 2020, which would have been when the year we started COVID, then it went down, and it's this 2021, 2022, it's down to 92%, which is concerning, especially if you are a public health person. And we'll come back to that. The lowest vaccine rate is in Alaska. And the highest is in Virginia, and Tennessee, you can see is with interestingly enough, with the rest of the country. What difference does it make? And we'll talk a little about that. But the one concerning thing is that public school children are 93.90% or 94%, and privately vaccinated children are 95%. So there is often a much greater discrepancy. In fact, Tennessee is doing quite well at this point in terms of immunizing their kids. And even though you have vaccine hesitancy, which means that by the time they get to be 4, they have not received all of their vaccines, only about 1% have no vaccines. So I had a patient, for example, who came in December. She is a no vacciner, but she came in with both of her children, one 6 months and one 15 months, for an influenza vaccine. Now, that's weird. Why is it particularly weird? Because for some reason in Tennessee, and maybe it's nationwide and other people can address that, we have real difficulty getting our African-American and Black families to take the influenza vaccine. I don't know why, but that's a vaccine which they will continuously refuse. Interestingly enough, they now refuse the COVID vaccine for their children and are more willing to take the influenza vaccine. And they've somehow gotten together and made a decision that, well, maybe we should take influenza because we ain't going to take COVID, as if there was some relationship. But it's an interesting phenomenon, which one can talk about later. Nationwide, vaccine refusal is actually a very small percentage of people. There's about 2.6 children who have a legal exemption, of which the majority of these are non-medical. So what's a non-medical exemption? Generally religious. 0.2% of those are of the exemptions that have been given are actually medical. Measles, mumps, and rubella has the highest rate of vaccine refusal or having no vaccines at all. Okay. But even though it's 3.9% of children in this country, it adds up to 250,000 children, which is one of the reasons why we continue to have outbreaks of measles on a regular basis in this country. We just recently, which I'll come back to, have one in Florida. We've had them in California. For those of you who live in California, remember the Disney, some kid from some country where he wasn't vaccinated, went to Disney and infected about 50 or 60 kids and families. In Tennessee, religious exemptions account in 2016, for 1.4% in 2016, 2021, 2.3%. That's another disturbing trend, which we're seeing more and more of, and in which in California specifically, as a consequence of the fact that, yes, we were having measles outbreaks. They just recently in 2023 passed a law which only allows for 2 exemptions. One's medical and the other is disability or IEP. In other words, if you have a kid who has autism or some other disability, which it's felt that giving them the shot increases their risk. I'm not exactly sure. I know that a lot of autistic kids, you got to hold them down for shots, all of this stuff, because most of the ones with things like the cerebral palsy, with seizures, etc., you would fall under the medical exemption. But in California, there is essentially no religious exemption. There is only medical exemptions. However, the religious exemptions in most of the southern states, Tennessee being an example, are increasing each year. And consequently, it is one of the ones that one of the issues that has to be dealt with. Now, part of this, and I picked autism specifically, if you remember, this is the poster child for vaccine refusal. This is Andrew Wakefield, who published an article in Lancet in 1988 trying to link MMR to autism. It was subsequently discredited, retracted, etc. 2004, he moved to the US and he now lives in Austin, Texas. He worked at what then was known as, quote, Thoughtful House in Austin, Texas, he was an expert and became spokesperson for the anti-vaccine movement. In 2010, he lost his license in Great Britain for fraud and unethical conduct. It turned out he was paid by the pharmaceutical. He was paid by a bunch of lawyers. At that time, when he did this research, they were introducing the MMR. Before that, we had separate vaccines. And by the way, in this country, you can't get separate vaccines. They just don't produce it anymore. And at that point, there were people who were trying to sue the pharmaceutical company that the MMR that their kid had gotten caused autism. So he did a research project with 12 other people in which they published in the Lancet, a perfectly legitimate journal, which has never been the same since. They've never been able to get their reputation totally back, in which he claimed to make this association, but nobody looked at the data. First of all, it took within a year of publishing the article, 10 of the 12 authors on the article actually withdrew their approval, and if you have done an article recently, they make you sign a paper as one reason they do it now is that every person whose name appears on the paper has to sign now, giving consent to public and testifying that they agreed with the findings. Well, 10 of the people submitted paper and said, we did not agree with the finding. We didn't know what data he was. He selected the data that he wanted to use to do it. Statistically, it wouldn't have made any difference because there was something like 12 people in that study that he did. It didn't matter. It was as a consequence of this, he became the expert and the main for anti-vaccine movement. And you still have patients, even though this has been totally discredited, and we're talking 1998. I still have patients who come in, and when you talk about giving the vaccine, I had one recently in which the kid had autism, and we were talking about giving the kid his MMR, and she said, oh no, we can't have that because it causes autism. Now I'm looking at this lady who has a kid who has autism. But this is the level at which we have misinformation. So we had a little discussion about, well, you got autism. And, I didn't bother to point out to her the fact that he already had autism, and he had not gotten a vaccine, which, by the way, is one of the ways that this research was discredited. That was by showing that before the introduction of the vaccine, the incidence of autism it was the same as after the introduction of the vaccine. If you look at vaccinated versus unvaccinated children, there was no statistical significant difference between the two. But the misinformation is still there. He did a film, which I don't know if anybody ever had ever seen, called Vaxxed: From Cover Up to Catastrophe in the USA. And 2016, people, this whole thing was discredited within 2 years of publishing the article, which would have put you to 2000. And yet in 2016, somebody paid for him to do a film in which was widely distributed among anti-vaxxers. Now, there are some high-profile anti-vaxxers, and as you know, many of these high-profile anti-vaxxers include very prominent people. And these prominent people, I'm on call for the nursery as always. I'll call you back in a minute. Thank you. These prominent people, one of them, for example, and by the way, I said Robert F. Kennedy and left off the junior, which, please, people, put the junior on there. What he believes in, I don't know. And why he believes it, I don't know. But he is now one of the major poster children for the anti-vaxxer movement. Jennifer Beals says, I am not an anti-vaxxer. I just believe in an alternative, and she would qualify, she feels, as a hesitancy because she just believes in an alternative vaccine schedule. That's what she says. And then doing the anti-COVID movement, so the anti-COVID vaccine got tied up with giving other vaccines. So a distrust of the COVID vaccine also became part of, we don't believe in any vaccines. So the politicization of vaccines, if you listen to the media, is really rampant around certain sections of our population. However, both the surveys that I talked about before were done doing 23 and 24. And so in spite of the rampant misinformation and disinformation that's around, most parents still believe in vaccinating their children. On the other hand, this is poor Melissa Goff. She was a high school teacher in Oregon. No, it was 2021. She had this brilliant idea to increase COVID vaccination among her children by, she's a high school teacher, by actually having vaccine clinics in the school. Then one of the school board, a bunch of anti-mask people, because remember we were in the anti-mask and all of that, they all got on the school board and they decided to make a relationship between her wanting to promote giving COVID vaccines and with anti-masking to the fact of she was promoting vaccine clinics in school. She decided to generalize it and said, well, let's not just focus on COVID then. Why don't we just have one of our little FQACs, very common, or one of our community agencies come in and we'll give all vaccines. We'll give make it for our parents, make this convenient for them. Anyway, they fired her. When the new school board came in, they said that they gave her somebody who had been teaching, she had been teaching for 16 years with no problem, but she got fired. And of course, if you're in Tennessee, this is the famous Dr. Michelle Fiskus. She was chief medical officer for the state of Tennessee until 2021, and she was fired. She was originally hired very specifically because Tennessee did have a problem with getting vaccines in terms of making sure their kids were fully immunized by age 2. What did she do? She wrote a letter and sent it out to parents she didn't send it to parents, she sent it to schools, in which she indicated that in the state of Tennessee, and this, by the way, was true. Note I said was. If you're above the age of 14, then you have the right to go and get treatment for communicable diseases. This is generally relegated to sexually transmitted diseases, but she implied that this right also involved vaccines. And there's been some highly publicized cases in which adolescents did go and say, my parents don't believe in vaccination, but I want to get this vaccine. She got fired. She sued them. She won. And they had to settle with her. I think she got $150,000 or whatever. But in the meantime, they drug her reputation throughout the country. And now she's the chief medical officer for the Association of Immunization Managers. And then we have Dr. Joseph Ladapo. Dr. Ladapo is the Surgeon General for the state of Florida. On 12/6/2023, he sent a letter to the CDC questioning the approval of both the Pfizer and the Moderna COVID vaccines due to DNA fragment contamination. And he said that they should be pulled. He was petitioning the CDC and the FDA to pull the vaccines off of the market. That's when he first became famous. Now he's in Florida, remember, and he was appointed around 2021 by the governor of Florida, whom you all know. In February of this year, in the middle of a recent measles outbreak, he sent a letter to parents. He's citing essentially the concept of herd immunity to justify a recommendation that states, due to the high rates in the community, which, by the way, he was using CDC data, which said that 98% of all children in this country were immunized against measles, as well as the burden of families and educational costs of healthy children missing school, that the Department of Health is deferring to parents or guardians to make decisions about school attendance. In other words, children with measles did not have to stay home. The letter itself, I read it, actually did point out that measles was a real disease, that it was contagious, that it was preventable. He also pointed out what the signs and symptoms were. And if your kid has any of these, it'd probably be a good idea. He didn't say you stay home, just said you should take them, consider taking them to your doctor if they're sick or whatever. He did not say anything about what you should do about vaccination, or whether those kids should be, if they are unvaccinated, if they should be vaccinated. Now, this is a study from the Pew Research Center, as I said, which came out on May 16, 2023. And it showed that regardless of all of that, the majority of people, parents, actually do believe in the value of the measles vaccine. But I will tell you, if you note that we're in the 88%, as opposed to for most of the other vaccines, for example, if you ask about diphtheria, pertussis, or tetanus, where we're in the 98% group. This is another one in which points out that if in the same study, that if you then look at Republicans versus Democrats, that actually, as you are not surprised, and note the 2019, 2020, and 2023, and note the major change in the attitude of Republicans versus Democrats. People who identify as Republican versus people who identify as Democrats. All right, vaccine rates are lowest among children whose families are below the federal poverty level. Vaccine levels are lowest, rates are lowest among African American and Hispanic children, and in children in public versus private schools, and children on Medicaid. They all have vaccine access to vaccines for children, which is free vaccine, but these are the numbers. And the question, of course, is of course, why? Is it an access issue? It shouldn't be an access issue. As we know, the Affordable Care Act made vaccines part of your routine well child care and your routine well adult care, by the way, which means you should have no copay. Medicare covers them, as we all know, but we have a large uninsured population, especially that population between 19 and 65. There is a large population of patients in that group. And we talked about, remember, the expanded recommendations for HPV vaccine. We talked about the importance of meningococcal vaccine and redoing your DTaP, et cetera, when you start college, et cetera. We also have the issue of special populations. Pregnant women are recommended to have a DTaP, to have a influenza, and now to have an RSV. The issue there, of course, is you're not doing it for the pregnant woman per se. You're doing it to protect the baby. And there's always an issue in terms of doing something to one patient to protect another patient. We have this issue of undocumented / migrants. Note, we now have an epidemic right now, a measles outbreak in Chicago at a migrant center there. We had one recently in the last year in a migrant camp down in Texas. And then we also have our homeless population, which does include obviously both adults and children, who are all tend to be uninsured and also not have access to healthcare. And the WHO has taken upon itself to try to immunize the rest of the world, but we have so far strife, war, et cetera. We know that has not been extremely successful, and we've eradicated, with the exception of smallpox, we haven't eradicated any other diseases at this point. Now, we did not talk about any of those things like malaria, dengue fever, all of those things that are also are important in terms of international populations, but we can talk about them later. There are 8 things in the chat, which we'll come back to, because I'm almost finished. In terms of health policy, one of the issues we have is cost. For example, in that Chicago migrant measles outbreak, there are 900 residents in that migrant center. If we assume even that 20% of them were children, to immunize each one of them, who's responsible for doing that? Who pays for it? Should it be paid for the federal government? Should it be paid by the city of Chicago? Who pays for this? One of the big issues in the migrant centers that we have around the country, in Texas and the other places there where we are housing migrants, that we have had deaths. We know we have had outbreaks. We don't get much in the way of reporting on these unless some news person reporter finds out that they had some kid that died, which usually what happens. Some kid gets taken over to out of the migrant center long enough to get to a health center, get where they die, and then that gets in the news, etc. But we have practically no data as to how much disease that we're actually looking at. The RSV vaccine that we talked about, public versus private, if VFC pays for it, and it's $227 a dose. These are per dose, people. Now, private insurance is $295. You can only buy it in a vial. The minimum amount you could buy is a vial of 5. That cost us $1,500. We have no guarantee at this point that the private insurers are going to pay us for it. When they first introduced meningococcal B, we felt ethically obligated to give it to both our private and our VFC patients because VFC was paying for it. So do you refuse to give it to your private patients? Or what's the ethical issue? We didn't get paid for it for several months before the insurance companies decided, yes, they would reimburse for it. And we talked a little bit about WHO and its efforts. We had a few years ago when they were trying to eradicate polio in Nigeria, which is considered a civilized country. They murdered 8 aid workers for giving the vaccine out. So this is not an easy, we think we have a problem. Obviously in other places they do. We won't even talk about the Gazas and the Syrias, etc. And for that matter, the Congo, I did a mission trip to Uganda, and there were 150,000 refugees in the refugee center, and trying to maintain immunizations, remember the 14 immunizations for children in that population is obviously almost impossible to do. Okay, final. All the studies to date still indicate that the person that the patients trust most in providing information and recommendation on vaccination is their personal healthcare provider. That's us. So it becomes very important to know and be educated about what to tell people when it comes to when they ask those questions. So anyway, that's the end of my presentation. And now, how do I get rid of the share? Stop share. There's a little thing there. Thank you very much. Now, there are 8 questions in the chat. I don't know who's going to control that.
We'll handle that, Dr. King. But
All
first,
right.
I want to thank you for this outstanding presentation. I was literally taking notes as you talked. I'm back in medical school. I'm coming to Meharry. This is outstanding. We learned a lot, and this is so useful. I want to start the questions out. I had so many questions, and you answered all of them. But just why is there a racial reason for some of the hesitation of vaccines among African-American public health people, Medicaid people? Is it being withheld? Is any of it willful? Or is it lack of knowledge?
It's, I have these discussions with families all the time. I remember sitting there with, we don't encourage vaccine deniers in our practice. Unfortunately, we've gotten more of them since 2019, interestingly enough, now that we get new patients, and we do not wish to be known as a group that actually is sympathetic to vaccine deniers. We do have one provider who happens to be in family medicine, who happens to be one who will agree to an alternative immunization schedule, but not in pediatrics. But I had a conversation with one of the ones that I had, and I asked the father, was he vaccinated? He said, yes, he was. I asked the mother if he was vaccinated. He said, yes, she was. And so I said, then why are we denying this to your children? Well, we just don't believe in it. Now, that's often the to me, which seems almost irrational discussion that you have with African Americans. They are less likely to come up with, I did give you the story about the lady with measles and autism, but she had an autistic kid. So she had been in an autism environment in which they had this discussion about why. But he'd never had it, so he couldn't attribute it to that. But most of them, I don't know. Y'all can help me out because that's the level. Almost every one of them have themselves been immunized. Up until recently, remember Tuskegee was an issue of withholding treatment. This was not an issue of treating. This was an issue of withholding. As my mother was, as I said, told you the story of my mother, who anytime anything came out she could get for her kids, she was right there. Because the concern used to be primarily in our generation, not access or what we could get, and what used to be not what we could get, but what they were not giving us. I'll give you an example. When they started we were one in the Maher was in the forefront of the COVID vaccines and giving them out. And we had COVID clinics, etc. When we first started, most of the people we were immunizing were not people of color. They were not Black and they were not Hispanic. We had people driving all over the state of Middle Tennessee and outside of Middle Tennessee, Williamson County, every place, white folks coming to get that vaccine. Whereas Black people did not, were very reluctant to get the vaccine. And again, if you ask them, the only thing some of them would think, we think that vaccine is going to give it to us. I mean, that's ignorance, but it's really, really difficult. My brother, who lives in Winchester, Tennessee, called me up to tell me he was in line to get his vaccine. The health department in Winchester had gotten some vaccine, Franklin County, but they didn't have many of them. So they didn't tell everybody. So the only people in that line to get the vaccine, he found out from somebody. He picked up my other brother. The only people in that line, which is why he was calling me from the car and said, we're the only Black folks in this line, because we apparently were the only ones who found out they had the vaccine. But then we worked really hard to give the vaccine, make the vaccine as available as possible. And we still felt like was pulling teeth to get these people to take the vaccine. And that's when it was free. Now, we have yet to discuss how long, if it's going to be free anymore, or how do you get it if you don't have insurance, et cetera, at this particular point.
No, thank you so much. Dr. Barbara Davis-Stevens and Dr. Walks and Dr. Hines, we want to ask some questions and have anything in the chat.
You're on mute, Dr. Neighbor-Stevens.
I want to continue on the thread that we were just on, Dr. Bean, because I, throughout, the COVID period, tried to figure out what was going on and ultimately came to the conclusion that it was primarily an irrational decision. But I've been thinking, not just today, but I've just kind of been thinking about all of this. And I guess what triggered it was there was a news story this week about some man who has lived in an iron lung because of polio for years, died at the age of 95 or something. He had lived quite a while in this iron lung, had become an attorney and had quite a full life despite being in this iron lung. But the thought came to me that those of us who personally experienced these diseases or treated patients who had these diseases and or knew of people who died, or children or adults who died from these or had the tremendous adverse effects of these diseases, knew firsthand, did not have to rely on somebody talking about it on social media. We knew firsthand what these diseases could do and why it was so important to try to prevent them. We have gotten so far away from that time, I'm afraid, that people do not have the opportunity of firsthand knowledge of any of this and are relying on what people are telling them. Now, I would turn to my psychiatric colleagues to explain to me, I'm trying to be diplomatic, but, what happened? Why these people who are the deniers and the hesitancy people, what is the psychological process that has happened or didn't happen, so that they are so vulnerable to the misinformation that they listen to and are not able to do critical thinking, apparently, to see the connection between prevention of something that will kill you or significantly injure you versus the risk associated with something that can prevent it. What is the cause and what is the remedy for that gap that we're seeing?
The other thing that I find interesting, first of all, I think that we got so used to the fact that we did immunize and that people were protected and we did believe in herd immunity, and we stopped worrying about it. So I think that as advocates, we stopped being advocates because we didn't think it was necessary to advocate for what should be just routine and which had become routine. Remember, the anti-vaxxers make movies, they go out there, they advocate, they're very loud, they're very visible in terms of their anti. We are not as visible or as active or as advocacy in terms of the pro and ways you should do it. And I think that's one of the things that we need to approach at a national level, at a personal level, and emphasize how important this is. And I think as providers that we're going to have to do that. The other one I find interesting is that we now have an attitude which says that they don't understand the idea of contagious disease. Now, you would think that COVID would be an example of what can happen when you have a very virulently contagious disease. People actually die. But as you pointed out, it becomes more real to them if a friend of theirs dies, if their aunt died, if their uncle died, if their grandparent died, than it does the fact that we had millions of people who died all over the world. That's harder. Because one of the things that we're using the Florida as an example, why would you send your child? You've been told that this is a very contagious disease. Most children do very well, but there are some populations who, if they are exposed to this, could kill them. But you still make a decision. That's not your problem. And I'm not sure I understand that at all. That one I have a whole lot harder to do. I have a child who is now adult who was immunosuppressed. One of her classmates who was an anti-vaxxer, and she said she even knows who it was, and he came to school with chickenpox. She got chickenpox. She spent 3 weeks in the hospital. Could have died. But in their family's mind, you know these people, you hear of them having chickenpox parties. So to everybody, because the natural immunity is better, it's natural. But going to school with it, and when I read stories about health officials who are in charge of, I happened to meet yesterday at a meeting. We now have a new school of global policy, and one of the new people we have hired, apparently two people back, she said, was the Surgeon General in Florida. And she said that, she told me, and I tried to be as nice as possible, but she said that the public health system in Florida was now a total absolute mess. That that nobody seems to remember anymore what public health is, because it's now become political health. And those kind of issues, I mean, come on, you had a president who was responsible, Project Warp Speed, who then gets disease, but now followers who is a vaccine, who wants to put the head of the CDC should be put in jail. I mean, because he was responsible for COVID. I mean, somehow or another, you know what I mean? These are the kind of things that you have to address. The good part is, and I keep reminding myself over and over again, even though unfortunately, when you look at some of the data and the trend does bother you, and hopefully that trend will be reversed. And I think the way to reverse it is for public health for the public health community to get out there and really begin to become as strong an advocate for actually doing the right thing and getting your kids vaccinated, specifically in this case, as the anti-vaxxers, for example, have become.
Dr. Wilkes.
Ooh, so much meat on the bone, as they say. Dr. Bean, first of all, thank you so much for a very clear presentation about this significant challenge. Try to hit a couple of things real quick. You mentioned that the primary care provider, the pediatrician, is the most trusted advisor for most people, which really illustrates what our dear colleague, Dr. Wilbur Jordan, used to always talk about, with everyone needing to have a primary care person. It isn't just a place to go to get care, but it's a relationship that you build. The thing about public health, as a former state public health officer, is that public health really is kind of what public health policy is really kind of what the public says it is, and the people that the public vote for. So you've got governors and mayors and other people who kind of help lead what that policy is. And so it's sort of like my little sister used to say when I would run real fast and fall down, she'd say, "That's what you get." And so it's one of those things where we get what we get from the people that we put into office. And I respect the concept that people used to experience these things and now maybe the younger generation hasn't. But I personally know people. I know one person whose husband died from COVID, and still she wouldn't get vaccinated because she was afraid what the vaccine might do. So and people who you respect, these other doctors and these elected officials who say this is bad, physicians may be the most trusted, but they're not the only trusted. And so other people that we trust, that we have relationships with, that we think have our best interest at heart, will say things. And it's not illogical or irrational. It's downright selfish and greedy. If it'll benefit me or get me elected, I will put all this stuff out there. And people are persuadable, and people are in some cases gullible. So I am getting something out of it. It makes perfect sense to me to do this kind of misinformation. So I think we have to be less kind with the people who are putting out misinformation and be more discerning about the fact that it's not silly and they have a purpose in mind. And to your point, Dr. Beam, we have to be extremely passionate and purposeful in our advocacy for people getting the best health they can and maintaining the best health they can. So I'm no longer thinking that this is irrational and these people are just ignorant. I think there is a very selfish and greedy purpose to it. And I think that they don't care that these kinds of opinions cost lives. They're selling books, they're running for office, they're doing things that matter to them. So it's up to us to do exactly what you said. But I just want to thank you for bringing the science to this and giving us cogent, rational arguments so we can have meaningful discussions with folks.
Thank you,
And
Dr.
I will point out, and I saw that particular chat, is that bringing on board the pharmacists and adding that to our armament of how we can get people vaccinated was extremely important, because it does become, that's where I got my vaccines, but it becomes, and I'll tell you one reason why. It's because for adult vaccines especially, it is much more difficult to actually keep all those vaccines in a private office, okay? Number one, and there's a cost. We have to pay the $1,500 to buy the, quotes, private vaccine. We have a practice that, remember where we are, we work primarily with underserved populations, almost all of ours are Medicaid, et cetera. We have a small percentage, 10% or so of private, maybe at about another 10% of uninsured, and uninsured get covered, children get under the VFC. So being able to have the convenience of going out on a Saturday morning and I don't have anything else to do, I'll go back and get my shots. I mean, seriously, which is pretty much what you did, as opposed to, even though yes, you should need your primary care provider and you should go to your primary care provider. But, but it is realistically, especially for adult vaccine, we do need the pharmaceutical and our pharmacists, and the fact that they're not part of our team makes things a whole lot easier.
Dr. Beam, I am so grateful to you for your outstanding presentation, and you have to come back. You have so much information to unload to us. I'm going to ask you for brief final conversation right now, and then our co-moderators, and we'll come back. we're at the way past the top of the hour.
Well, I noticed that y'all were past the top of the hour, people. So I have nothing. Thank you very much for the opportunity to address this issue. And I've gotten a lot out of just hearing from you all. As usual, every Sunday. Thank you.
And we also had another outstanding presentation a few months back from the president of Meharry. So you have followed in his footsteps. Dr. Walks.
Dr. Maxey, since I talk so much, I'm going to defer my final comments, and if I may give Dr. Lawson the mic. He has his hand up. Thank you, Dr. Bean.
Dr. Lawson, we have brief comments.
Yeah. First, whoops. Can you hear me? Because I said
Yes, we can hear you.
Yeah, I just wanted to note that unfortunately, I'm not going to be as optimistic as some of you are. I think that some of these issues between blame everything else on slavery, we can blame this on slavery as well. We developed an environment in which we did not have access to treatment, or treatment was in fact toxic. And that's exactly what happened in slavery. So we've developed attitudes, belief systems, and everything else so that things like vaccine are considered white man's invention, which it is not. The fact that these may be toxic, another way of wipe out Black populations, which is not. And what our research has shown has not changed that very much. Everything that's been said was said during the AIDS epidemic. Those who are old enough to remember the previous pandemic, some of these same issues came up. And again, African Americans suffered. So this is not going to just be doing public relations. This is going to be literally a focus on lifestyle change in which we work to get folks to change behaviors that are self-destructive. And I count this as one of them.
Thank you, Dr. Lawson. Dr. Nabus-Stephens.
Thank you. Thank you, Dr. Bean, for being with us. We look forward to you coming back, hopefully in the near future. We have a whole lot more to talk about, not only just vaccines, but other issues affecting our children. I look forward to you coming.
Can I just interrupt to warn you, Dr. Bean, and to warn Dr. Nabus-Stephens? I'll be coming to Meharry next month for facilitating part of an AI conference. So if you see me, tell them I'm just there temporarily. I'm not there to cause trouble.
Looking forward to it.
Well, thank you so much. Everybody have a great Sunday afternoon. Dr. Bean, we want you back. We want you back. We want you back. And thank you, Simon, for helping today. Everybody have a great Sunday afternoon.
Good day, everyone.